this is the last session for the day, so let's make it interesting because we have two very interesting people on the stage. We have Padma Shri, Dr. Harsh Mahajan and Siddharth Nyalani here, who you all know. I'm sure all of you have used Practo at some point of time because it's a very popular platform. Now, we are talking about living longer and living healthier, the new healthcare imperative. India, as we know, we are now seeing a longer lifespan among people, but we're not seeing a longer health span. So that gap between the lifespan and the health span, when I say that, I mean how many years of your life are you actually living disease free? When do you get some sort of ailment or the other, and is that lifestyle related? Now these are some of the things that we will tackle here. We live in very interesting times now. We have technology that can track, monitor, and even give you preventive advice up front, but how many of us are willing to take that? And I think that's what I will start with by asking Mr. Mahajan, um, you know, how much of a priority does India give its healthcare?
I think in India, in the last maybe 4 or 5 years, the priority has risen. Before that, it used to be a very low priority area. Health, fitness, even preventive testing. COVID actually brought home the fact that what we used to, be told in school, health is wealth. Actually, even the entire world realized that even the wealth of nations is dependent on their health. And so we've seen that there's been an increasing focus on staying healthy, on staying fit. And like you said, from expected lifespan of 32 years when India attained freedom to 73 years now, healthcare did achieve a goal where the US is at 75. So, but like you very rightly said, the last few years of life, do you want to be in a wheelchair? Do you want to be struggling? Do you want to be bedridden? So the focus now has increasingly come to wellness. And I would also credit some of the startups of the last few years, maybe spurred on by what happened during COVID, the so-called aggregators of health testing and health treatment, illness, who came into being, and whether, some of the established players felt that, something that costs 1,000 rupees, how are they selling for 200? And, the burning of money that happened. But it did increase the awareness. It did educate people at large and probably have opened up a new area of wellness and fitness which has come.
Right. But there seems to be, because of this proliferation of labs that now can do health checkups and this whole cost competitiveness that is there, there seems to be a trust deficit.
There is very definitely a trust deficit. And so a lab where you may go for a health check because it's cheaper, you would not go yourself or send your father or mother to, or your child, when you are sick. So that differentiates the lab you trust from the lab where you say, chalo hum kara lete hain. What's the harm? This is getting done at some 999 number. And so what we've also seen, that many of these have not survived. You can only burn that much money and not more. And those who did not provide good service or accurate reports or good treatment have also fallen by the wayside. So I personally feel they've done a good job in creating awareness
Awareness.
and let the best man and the best service provider survive and thrive and grow.
Right.
This should not be something that should be looked down upon. Many in my, field do not agree to what I say.
Yeah.
They say nahi ye band hone chahiye. But I think the market will determine who
Right.
stays and who does not.
Right. Now, Siddharth, now technology obviously plays a big role, and you've built, been part of a technology company that has scaled to such a large extent and made medical advice accessible. I mean, we are so used to now 10-minute deliveries at home for groceries. This is instant advice on the phone from your doctor anywhere, right? So. How can technology like this now actually force people to look at preventive health checkups much better? Because I think we are so used to probably servicing our car because your service station will call you 5 times saying car ka service due hai, car ka service due hai. But when it comes to servicing your own body, we don't do that. We keep postponing it. Why is that?
Right. I think the behavior is changing, like Sir mentioned, post COVID, because insurance penetration is what has gone up dramatically. Almost all insurers, both corporate and retail, offer some kind of a health package in their offering. And I think on our platform also, we see the largest chunk of health packages or preventive health checkups coming through a payer, which I think is a positive indication. What often happens for corporates is the payer probably covers the employee, and then the family gets kind of an upsell, but actually the family gets covered, right? So the employee is aware that, okay, I am going to go to a lab, I'm going to get a report, and then I can also get my family along. So I think that the more insurance penetration goes up, the preventive health coverage is itself going up, because the insurer is the true person who has the incentive to keep the person healthy. Like we were at the panel earlier talking about exactly this, right? So they are the ones who economically need people not to fall sick. The healthier lifespan is actually most affected by the profit margins of the insurance companies. So they should probably push this even more. And of course, they control. So we work with a lot of employers and insurance companies. We service the health packages that they give their employees. So insurance companies are very selective about which labs to put in the panel, which labs not to put in the panel. Some of them insist on only large corporate hospitals and only their employees to go there. So they are very worried about quality. I'm quite certain of that. Now, how much of that is going to retail is still a very small sliver. I think the number of packages we do where consumers pay it for themselves is a very small pie. Among all the health tech companies that I can talk about, the very large majority are still payer-sponsored preventive health checkups.
Right. And that's what I was saying. I mean, unless somebody pushes you to go and get a health checkup, we don't do that. Now, insurance companies obviously have the incentive to do it because they're collecting this data and it helps them in the long term. So if you have a long-term healthcare package, they know how much of a premium you're going to be paying. So that is there.
They also actually can increase the premium
Exactly.
based on what
How
they
sick you
find,
are.
whether you have diabetes or some borderline heart disease. So they are incentivized that
Both
way
sides,
also.
Both sides.
Yes, I mean, earlier it used to be just age-based, but now it can be based on actual data, right? So coming to that, I mean, you touched upon diabetes and heart disease and all of this, which is all new NCDs which are now getting even more prevalent in India. How do you think this can be addressed? How do you think you can stem this? Since you have a vast database of
Sure.
medical professionals.
So I was just looking at our traffic volumes. So the last 24 months, diabetes, hypertension, and cardiac searches are doubled. And it's not that the whole website traffic is doubled in the same time. So clearly disproportionate growth is happening in exactly these categories that you talked about. And it is a sign of an aging population and probably a lot more awareness as well. People are no longer I would say self-diagnosing or doing home remedies. They're actually saying, okay, let me take an opinion. It's accessible. It's not as expensive. You could be sitting at home on a 5 p.m. on a Sunday and talk to a cardiologist on an application like ours, and then there's so many others, right? So the awareness is definitely going up. And I think it's also about what portion of the population is hitting the 60s. I think we're about 10% of the population is probably over 60s, but that also is going to double in about a decade and a half. I think that's the stats. So I don't think we have a dearth of providers. We have the right doctors. We have enough doctors to at least service the metros and maybe even tier 2, tier 3 cities. But what a platform like us is trying to do is make it super accessible. And it's actually not affordability that we need to solve. We don't find people either increasing the likelihood of consult because of a discount that hasn't worked. It's actually the promise of trust and quality. The more we're able to show that this is a great cardiologist who's had so much experience, they've already had so much outcomes in the past. We actually collect a lot of outcome data. Another panel earlier was talking about do we to collect. So we talk to consumers a month after they consult, check on the outcome of whatever condition they went to, share that with both payers and consumers as well. So I think increasing access is the key.
Okay. Yeah, Dr. Martin, we were talking about lifestyle disease and increasing the outcomes. Now, you are more of a traditional testing. They are using a technology-first platform, but you are looking at the more traditional form of healthcare checkups and all of that. What impact have you seen technology having on your kind of testing?
See, we also have, especially because we started as a radiology and imaging
Yes.
player, so we've been digital since 30 years. And so adapting to the newer ways was simpler for us. And we've done that, maybe not as robustly as maybe necessary, but by and large, we, as far as outreach to society at large, to people is concerned, we are there. And but we still find that trust increases when there is no digital in between, when it is more face to face, or maybe even on the phone when they talk. And as Siddhartha has said, when it's a doctor who's well known, trusted, then it works much, much better. Also, because we have started this concept of integrated diagnostics, where you break the silos of radiology, nuclear medicine, pathology, lab tests, genomics, all together, because ultimately what you need is a diagnosis. This is the era of evidence-based medicine, and both the consumer or the patient as well as the doctor, no one is going to move without evidence. That day is gone. Because many times people say, पहले तो नब्ज देख के दवाई देते थे, ठीक हो जाते थे. Then you have to remind them तब 32 years life expectancy होती थी, अभी 73 years है. So from that point of view, I think this digital outreach, the outreach through the social media, education and awareness created through the social media, I think is a must. Whether every player should be doing it independently or they should get together so that authentic information is given and there's no hoopla or hype falsely created.
Correct.
I think that's something the healthcare industry needs to internally think about.
And there's the sharing of data with the government has also been talking about a unified database where you can access all of this data. Now, how much of technology does the consumer really trust? Now, there are platforms like yours which are moving on to full-fledged digital healthcare interventions and even checkups. And while something like a Mahajan lab would still have trust more in a face-to-face kind of thing.
Sure.
So this brings in two questions. One, technology and the ease of accessibility. Maybe it's coming for a younger generation who are probably using that, while the older generation still probably trusts the phlebotomist more directly when he advises something than trusting the app.
Sure. I think trust gets, of course, built over time, and it's built with evidence. Labs and brands who spend so much time and decade have, of course, earned it through great outcomes in the past. But I think what the future unlocks will be that a lot of consumers are going to go into starting to manage their health records longitudinally over some platform. Like I know a lot of people who have just been posting their health records onto ChatGPT, and ChatGPT has now started building context about you, right? I'm sure some consumer products we are trying as well, but I'm sure a lot of companies are trying to build these health assistants or a health dual personality of yours. Somebody's going to crack that, and that platform will become the digital twin that will start recommending things to you. I don't think that future is too far away. All of us are going to already have agents that are doing half the things for us. Health is not going to stay away. Why I can see that is uh, Google is the primary traffic driver to Practo today. Most consumer searches start for doctor for X, doctor for a condition on Google, and then consumers land up on us because they discover us online, right? In the last 1 year, I think about 10% plus traffic is already moved to come via a AI agent already, right? So consumers are already starting to consult the AI agent, giving it reports, already uploading reports, making it do analysis and recommendations, and then saying, okay, finally when I'm trying to transact and go to a doctor, find a hospital, find a lab, then they go to a partner like us or maybe a lab directly, right? So that is definitely the future. It's going to go away, and trust is being built in that irrespective of whatever all of us are doing. So I'm sure we're all preparing for that worldview and trying to participate and get a slice of that as well.
Okay. Dr. Mahajan, how ready are you for this sort of
We've
recommendation?
been actually, also delving into research over the years. So for the last 10 years, we've been building AI products. Initially, AI algorithms for solving radiology problems.
Right.
And then ultimately, we saw that there are many products available globally, nothing being used. And that's when we thought, let's become a platform. Something like a Amazon. I mean, I'm saying a big word, an Amazon of AI algorithms. And that's what we became, and that's something which is run by my son, who is a physician with an MBA and now doing mostly engineering work, if I may say, where Carpal.ai is a startup incubated in Mahajan Imaging and Labs. This is the only AI platform currently in the world which is US FDA approved and CE marked. It runs in some of the best hospitals of the US, at Harvard, at Stanford, and so on and so forth. The Singapore government uses it for its hospitals. And I do agree entirely with Siddhartha that AI is going to play a major role not only in diagnosis, but also in treatment. In the doctor sitting in his clinic, making a decision on treatment A, B, or C, AI will help. We do hope that a human will remain in the loop. But I do feel AI in the next 5 to 7 years is going to become so strong that a human may even become redundant for certain parts of this whole ecosystem. So I think those who fear AI, those who do not want to adapt or adopt AI, are going to get left behind.
One before we end, one quick thing. Now we also have a lot of constant monitoring health apps, right? Which continuously monitor your sugar, your BP, all of these things, heart rate, etc. How trustworthy is that kind of data, especially for a doctor? Because there are so many apps that do this. So how do you filter out what's right and what's not?
I mean, trustworthy is based on the sensors and the algorithms they run at the back, and I think how relevant is it and how much of your entire picture can you draw just based on those is what is limited. For a bunch of conditions which are around weight loss, obesity control, maybe to some degree diabetes controls, many of these will help. But clearly without like attached with a path, attached with a radiology, it wouldn't show you the picture. So you possibly are not doing preventive health if you think a fitness tracker and a CGM are enough. They're not. Yeah. We're now discovering that, we're just talking to Dr. Earlier, Dr. Mahajan earlier, and he's saying they're launching a new MRI, preventive health MRI facility. And as an offshoot of Practo, we've also launched something recently in Bangalore and now Gurgaon, where we're saying annual full body MRI is what will tell you whether there is a growth that you did not know about that could potentially become a problem in a couple of years from now. So these sensors are useful and probably great for managing a condition. Maybe a diabetic could manage his diabetes very well,
Right.
but they're not enough and they can't be called into all of preventive health.
Right.
Also, you know, the pleasure of living. Is the app going to regulate you, or are you going to be regulating what the app says? And do you want to live a full life, or have that heart rate control what you do or not do? I mean, these are very individual, personal decisions.
Right. So coming back to that lifespan versus health span, you are in charge of your health span actually. Lifespan is anyway fixed with the way you're
And these medical things are only part of the whole game.
Right.
I mean, your mental health, your fitness, how you know how much you sleep in a
Yes.
day, what are your waking hours, how much sunlight you're getting. There are so many other aspects to it. Of course, these tests, prevention, all these are important, but there are so many other facets to life which also have to be looked at to give you a much better quality of life, a fulfilling life.
Right. So, like you said, the choice is entirely with the consumer, and you know, even though we are living longer and having healthier lives, it is again entirely with the consumer how you make it out to be and what motivates you to go and get your health checkup. So, on that note, thank you so much, Siddharth, and thank you, Dr.
Thank
Mahajan,
you so much for
joining
having me.
Thank you so much.
Thank you very much.
Thank you, sir.